Doctors of Reddit, what are some of your anti-vax parent stories? We had a 14-year-old female come in for abdominal pain one time. She weighed 80 pounds, looked sickly. Her mother refused to let her eat anything but a handful of things, nothing with very much protein at all. She literally had a binder full of articles about how horrible vaccines are, all the bad things they put in food these days, etc. She had completely brainwashed this kid, so the kid believed it too. Her labs showed malnutrition, her teeth were horrible. Just a sad case all around. Nearly qualified pharmacist here, so obligatory not a doctor. Our pharmacy offers travel vaccines for people going away to countries with a high likelihood of severe tropical disease. Star parenting goes to the parents who got themselves vaccinated for rabies, but not their two primary school age, elementary, for non-Brits, children. Please for the love of God be trolling us. How can you vaccinate yourself, but not your children? If anyone is getting vaccinated it's my child not me. WTAF is wrong with people these days. I was a medical student when this happened. My attending pediatrician gave me a heads up about the parent I was about to see and decided it would be best if he came into the room with me. 4-year-old kid came in with a horrible cough and difficulty breathing. It was almost sure as hell pertussis acre whooping cough. The kid was coughing so bad he vomited on the exam table. He went on to ask about vaccinating her kid and of course she replied no, even though her son was damn near coughing up his lung right next to her. I think my attending had seen enough and had enough of her not vaccinating her kid and had the following conversation with the kid's mom. Attending, Mrs. I have to ask you, do you trust me with as your son's doctor? Mom, of course I do. Drive attending, well, there's two problems here that we need to address. 1. You either think you are more knowledgeable than me when it comes to medicine, and if that's the case I should no longer be your son's doctor, or you don't trust me as a physician, and in that case I shouldn't be your son's doctor. Mom, blank stare on face. Attending, will you please reconsider giving your son a vaccine? Mom, no. My attending obviously treated her kid, but after this whole ordeal resolved he fired her and her son as a patient and referred them to another pediatrician. He had enough of her shit. I respected the hell out of him after he pulled this move. I think it's important to stress here that surviving pertussis won't give you immunity to it. Please correct me if I'm wrong. Edit 2. Here you go. Can't get much better than B. The mechanism of immunity to pertussis after natural infection or immunization is complex and not fully understood. Immunity has been shown to wane 7 to 20 years after natural infection and 5 to 10 years after immunization with whole cell vaccines. My nephew had it multiple times as a child. He was vaccinated, and we never found out how he kept getting sick. Eventually he grew out of it. I lived with my sister and her husband. We didn't sleep those nights. We took shifts watching him. I will never ever in my life forget the sight of him standing there, tears coming down his cheeks, nose stuffed with snot from the tears, red-faced from lack of oxygen. He did 4 little gulps, like, herp, 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 just trying to get some air, and finally a few big gasps, that whooping noise, like a gurp, but all windy, like they're sucking in. You could hear his lungs and his tiny body whistling from a couple feet away. He never vomited, which we can thank the vaccine for. His longest sick time with major symptoms was 3 to 4 days instead of a week or longer, which we can also thank the vaccine for. But he was around 2 to 3 at the time, and seeing that tiny body try to fight so hard was so scary. When I was a med student, I had a parent who wanted to do a delayed vaccination schedule. Basically it means that you get all the same vaccinations, but you pointlessly and foolishly do it over a longer time period. The mom had read a book promoting this practice that was unfortunately written by an MD. My pediatric attending had zero chill. Is that the book written by Dr. Yes? Well, then you should know that I was in the same medical school class as Doctor, but I got much better scores than he did. In medical school I saw a kiddo whose parents refused vaccines, and so when they were given a vaccine refusal form to sign, this form essentially said that the parents understood that refusing vaccines was against medical advice, that their kiddo could get sick from all those preventable diseases, and that they wouldn't hold the doctor/practice liable for any complications that the kiddo may get from said preventable diseases. This mom pulled out a Sharpie and blacked out the part about the doctor not being held liable. The parents thought that we'd be cool with them just changing that form just for them, and they wanted the doctor to be held liable for their moronic choice. Of course this didn't work, and they were told to sign the form or they would be discharged from the practice and have to find another. They refused to sign and were told to leave after given a list of other pediatricians in the area. Friend of mine is a military OBGYN. Was at a job appointment with the pregnant dependent and service member. He had just returned from AFG a few months prior. OB mentions about follow-ups after delivery in first year of life, including vaccines. Wife says, I read on the internet that vaccines cause autism. I don't think we are going to do that. Husband says, I saw a lot of little graves in Afghanistan. Sure as shit we are getting our kid vaccinated. Points for dad. To be fair, husband is ex-military. He has had so many vaccines. I think he's good for everything. He doesn't get sick ever. And I mean he's been vomited on, had our kid sneeze in his face and open mouth. When he gets sick he's only sick for a day and it's normally just a fever, and then he's good. My 6-year-old got everyone sick once. I could barely get out of bed. The kids were all out for the count. Husband was loving the time in front of the TV, said he wouldn't trade making chicken noodle soup for all of us for anything. I'll tell a different kind of story. I'm a nerdoc and recently had this interaction with a patient. Adult male comes in with fever. He comes back positive for the flu. Me, you have the flu. I will write you for a prescription for Tamiflu. Patient, doesn't that cause autism? This guy couldn't even remember that it was vaccines that reportedly cause autism, and he couldn't remember that it wasn't the flu vaccine. And of course he is wrong about vaccines causing autism, and he is a grown-ass adult that thinks he will suddenly be autistic. Tamiflu doesn't cause autism, just causes empty wallet. Source, had to take it once. I paid like $20 for it at a CVS in the US. Not a doctor, but a nurse and a vaccine advocate. Once had a public argument with a friend from long ago. He argued that by not vaccinating his kids and risking terrible side effects and possible autism, he was placing no one else at risk, however acknowledged the potential risk to his kids. After attempting to explain the potential risk to others and him failing to understand, I created an analogy which I still use to this day. Imagine if my kids and your kids get into the same car. Both of your kids don't put on seatbelts. Therefore, if there is an accident, there is an increased risk that your kids will die and also harm my children in the process. This seemed to click with him, and he doesn't share his anti-vax propaganda on social media anymore. Not a doctor, but a nurse and a vaccine advocate. Once had a public argument with a friend from long ago. He argued that by not vaccinating his kids and risking terrible side effects and possible autism, he was placing no one else at risk, however acknowledged the potential risk to his kids. After attempting to explain the potential risk to others and him failing to understand, I created an analogy which I still use to this day. Imagine if my kids and your kids get into the same car. Both of your kids don't put on seatbelts. Therefore, if there is an accident, there is an increased risk that your kids will die and also harm my children in the process. This seemed to click with him, and he doesn't share his anti-vax propaganda on social media anymore. Med school student here. I was getting my hair cut, and I was talking to the barber about how more people should get the new meningitis B vaccine, since I know a person who got meningitis B and almost died. The desk lady went off about how vaccines are dangerous, and pretty much every single anti-vax talking point. I explained the actual facts behind vaccines, and said that I'm studying medicine. I think I might know what I'm talking about. And then she went off about professors not knowing what they are talking about, and that they just teach what they are told to teach, so that we can all be brainwashed into supporting the big pharmaceutical companies, and that my proof were all fabricated by them. This is the sad thing. You spend years and years studying something, learning the intricate details, watching and doing experiments, etc. Yet somehow, in the mind of some people, all this process makes you less knowledgeable than a random person. They wouldn't try to repair a broken leg themselves after a 2 hours Google search. They wouldn't enter a plane if it was piloted by someone who only read web blogs and repaired by a random passerby. They wouldn't inhabit a house if the architect's only formation was a couple of YouTube videos. Right? So why the hell are doctors considered not knowledgeable and irrelevant in terms of diseases and vaccines? Same for climate sciences and global warming, etc. My mother's dog was sick and was at the vet. Was bladder stones, treatable but needed surgery. She wanted to take the dog home with her and ask me to, basically, look up bladder stones in dogs until Google gave me enough information to justify taking her dog home. I refused, said that none of us, nor Google, have any experience with veterinary care and that the only advice we should take is from our veterinarian. If she didn't trust the vet, then we can get a second opinion from another licensed and credentialed vet. We ended up proceeding with the surgery, but at a non-emergency clinic that had an opening. The second vet confirmed the first vet's diagnosis and solution, and the operation went well. This was small stones in a small dog, so it could have easily been fatal. Google will feed you any information you need to confirm your bias. Baby boomers, overall, never quite figured out how to be discerning enough. I have the opposite of what you're expecting to hear, I assume. As a medical student, I went to see a young child, less than 1, in the outpatient clinic before the attending. The child was due for vaccines, and I talked to the parents about getting them on that day. The parents said they had reservations about them, so I talked to them about their reservations. We talked about all of the things they had read on the internet, and walked through each point one by one. One of the benefits of being the medical student is that you have nothing but time. I explained how vaccines are made and how they work. They don't have the mercury preservative they once did. Some vaccines are live, but attenuated, and others are immunogenic sequences bound to a protein. And why we get so many so early, that's when you're most likely to be affected by these diseases. They were concerned about the effects of so many vaccines at once. This is a common concern. But we challenge your system less with a vaccine than you see walking around in the world every day, and about them making the child sick. Not possible with anything but a live vaccine, and that's why those are attenuated. They're such a small dose that a non-immunocompromised individual should have no problem with them, even though you might feel a little sick, because we activate your immune system and that's how you feel when that happens. The whole discussion took probably half an hour. And then they decided to go forward with the vaccines. As it turns out, most people are just scared. And who can blame them? With all of the misinformation in the world, it's easy to see how parents get to that point. But they also are human. And when you sit and talk to them like the people that they are, intelligent and able to understand your points, they respond in a positive way. It's one of the moments in medical school that I reflect on frequently, especially when things are tough, and I feel like being impatient with people. Edit. Thanks for popping my gold cherry, y'all. So happy to hear about everyone who has had similar experiences with doctors taking the time to listen to their concerns and explain the responses to them. I hope everyone can work to reduce cynicism about this and other important problems. I had a kid come in that was super sick, 3 years old, and in septic shock. He had the flu and another compounded viral infection. I want to say pertussis. Heart rate was close to 200, respiratory rate in the 50s, blood pressure in the 70s. Kid was so fucking dry that we could barely get fourths into him, and I almost had to drill an IO. We dumped a ton of fluids into him, started him on vasopressors, and transferred him to the local children's hospital. I had asked the mom if he was vaccinated, and she said no. Vaccines have really bad side effects. They'll make you sick. I explained to her that not getting the vaccines had made her kid 10 times sicker than he ever would have been from any mild vaccine reaction. She told me I was a fucking moron, and that I obviously have no clue what I'm talking, and that's the reason her kid was getting transferred. She also told me that recommending she vaccinate her kids was racist. Thanks for watching. Share your own stories in the comments section below.